so used to eliciting that from, we're very focused on the family system. What can we do that we haven't articulated enough as a field? We can't state as clearly as we could what is it that we bring, what's unique about us, and how do we make that work both in the clinical area as well as the research area. And so in that way it is a differentiation in terms of not, I've always been very clear about, as a department chair I see the difference between somebody who's trained in psychology and sociology as versus somebody who's trained in human development family studies, and particularly marriage and family therapy. So in that way it is to be part of another group but not take on that identity. And to lose what I think is important in terms of application, in terms of sustainability, in terms of really getting a commitment to messy research. I have very little, there are a bunch of researchers that study attachment from a social psychology perspective. They have very, very large samples. They do very fancy statistical techniques, but they're so removed from the data. They're so removed from human interaction. So I haven't I forget what I was going to say on that.
Well, you talked about messy. Can you talk?
Okay,
the willingness to engage in messy research.
So it's very clean. They have all kind of covariates. They do this and that and the other thing, but it's not meaningful to me because it misses some of the major issues. Like I don't think you can self-report on your own attachment style, for one thing, and so it's all based on self-report, and it's based on, like I was looking at one study recently where they were asking people about relationships, long-term relationships, and only 45% were in a long-term relationship because it was basically a college student sample. So I like messy research, and I think, but the measurement issues that we face and the messy questions we face, I think do have a respect in terms of NIH, and people know that we get stuck. You do all these fancy studies like Project Match, or the controlled multi-approach depression study, and the more they get kind of clean up, try to really do these massive millions of dollars funded studies, and they come up with not so much, and it's because they're too divorced, I think, from the messy experience that we deal with on a daily basis as family therapists.
So what makes something messy? Is it the fact? Is it being that connected to the issue, to identifying with what's going on, or is it the fact that there are so many confounds and covariates that you cannot possibly control for all these things, or and maybe part of the messiness is that people deal with the messiness by going in a qualitative route and maybe only interviewing 5 people.
Right.
And then we can kind of understand what these 5 people are doing, but that doesn't really tell us a lot about the rest of the world.
Right.
So a willingness to, has that driven your own research agenda, a willingness to engage in messy research?
Messy.
Okay. People, I don't know if it's a synonymous term, sometimes university administrators talk about big, hairy, nasty problems or something like that.
Something
being willing
like
to
that.
Attack these big, hairy problems or whatever.
Right. I think that's, I think that it's sort of in our nature as family therapists that we don't want to reduce things to a few variables. We don't want to just say, okay, it is this one answer, it is this one gene or something like that. That we really welcome the complexity. We always look at multiple levels, and yet we're trying to see the threads through there in order to, okay, with a family system you have to be able to enter so many different ways and use so many different angles to get any place. It's the same with the research. You have to be able to come in at it so many different ways, and yet we have a set of basic skills, basic tools that we can use to do that. And I think, again, we haven't articulated that well enough.
Do you think we'll get there? I mean, do you think we will get to that place where we can articulate what it is we do and the research contributions we make, and will they be respected?
The respect issue, it's like empowering ourselves. Nobody else is going to empower us. to have the confidence to do it, and to always stay out of that place of wanting to be a mini psychologist or a mini sociologist, or gosh, because when we look back at our own careers, we think, okay, there's a reason I went into family therapy as opposed to being a clinical psychologist or a clinical sociologist or a physician. And what is that reason? And to stay focused on that. It does relate to if we continually worry about we're not a psychiatrist or we're not a psychologist or something like that, I think it is that we will get to the point of defining what we are and why it is that we're important.
Well, some of the discussion that we have as MFT researchers is about do we adopt a stance of really defining who we are, kind of circle the wagons and do our thing, or do we collaborate? And my guess is that the answer is probably yes to both of those things. How do we do that, or do you think it's possible to have good examples of people who collaborate and yet are well defined within our field? It seems like
Right.
If you go off in one direction, you're kind of lost, or the other direction, you're lost in a different way.
Right, exactly. I think it goes back to what I was saying about differentiation. To know that your strong base, your discipline base, is family therapy, and yet that the only way out is through collaboration. When I look at that it's a core issue is to be to be connected to the outside world in terms of research and practice. But I'm thinking about like your own work with the work that you've done with the marriage movement, and you learn so much by being connected to the outside world. I think that, but it comes from, a psychologist doesn't worry about who they're working with, but they know they're a psychologist, but they're not having to prove ever that psychology is a discipline or that psychology is an important profession. It's just a given. I think we need to treat that fact as a given.
Yeah, and move away from that
Move
discussion
away
altogether.
and just go. I look at my young colleagues, Adrian Blow, Ruben Para, yourself. They just go for it. They just go.
Claim it.
They just claim it.
Yeah.
Adrian, the Department of Psychiatry, researchers in the Department of Psychiatry had to seek him out because they were wanting to do work with veterans who were returning who had PTSD. And every place they went in the military in the state of Michigan, they were saying, no, we work with Dr. Below. So psychiatry had to come to Adrian to say, could you join with us and do collaborative work? Because and then he knows how to work with couples. He knows a family systems approach. And same with his work with breast cancer in the medical school. Ruben with his work with parenting and fathers. It's just, it's seamless, actually. And he doesn't,
Once they
own it.
Differentiate, once they own it.
Once they own it.
Yeah.
I think we handicap ourselves. There's some other ways we handicap ourselves in terms of what we do as MFT faculty, in terms of all the different things that we do. And we don't allow ourselves, we're very giving people. But that's another